just are like, they just don't take it seriously. So it's kind of just like, if you don't take COVID seriously, then you're definitely not going to see the necessity of getting a vaccine against it.
We're live on Facebook now as well.
And we're letting people in now, Sam?
Yes. I'm going to start the 5-minute countdown as well. Well, welcome once again to another fresh experience of what we're doing to continue to stomp out COVID through our faith, facts, and the science. At this time, I want to introduce you to Bishop Kelvin Simmons, who will give us an opening prayer, and then I'll lay out an agenda for us today for our gathering tonight and acknowledge a few of our partners. And then we're going to put you in the very capable hands of all of those who have come to share with us tonight. Bishop Kelvin Simmons, introduce yourself, sir, and tonight.
Thank you so much, Pastor Casey. I'm Bishop Kelvin Simmons, President of the Inland Empire Concerned African American Churches, IECAAC or IECAAC, and also co-pastor at Emmanuel Praise Fellowship in Rancho Cucamonga, California. We welcome you to this summit for such a time as this. We have been on almost a year's journey where we began to work together in collaboration with COPE and our community partners to stomp out COVID. We tested, we educated, and now we are helping with the vaccination process. But the purpose of tonight, I like to put it like the way James put it in his letter when he said, if any of you lacks wisdom, you should ask God, who gives it generously to all without finding fault, and it will be given to you. Tonight, we will, with our experts, give the wisdom that we believe are the answer, or is the answer to the questions that you have regarding the vaccines. Let us pray. Gracious God, our Father, we thank you. We thank you for this time, a time that we can gather and gather information that will help us make great decisions on behalf of our families, ourselves, and our community. So we invite your presence. We ask that everything goes to the desire of your heart, that our people, your community, and your congregation will be blessed by the wisdom that is provided tonight. Move through us and for us. In your name we pray. Amen.
Amen. Thank you so much, Bishop Kelvin Simmons, President of Inland Empire Concerned African American Churches and co-pastor, my partner in crime in this thing since we've begun, co-pastor of the Emmanuel Praise Fellowship Church in Rancho Cucamonga, California. We have several of our partners who are on tonight that I certainly want to recognize. I see Pastor Terry Starks of Rubidoux Missionary Baptist Church. I also see our partner who invited us to the table, Councilwoman Leslie Altamirano, who has joined us tonight. Also partnership, SAC Health, Inland Empire Health Programs, or IEHP, Inland Empire Health Plan, or IEHP, Loma University, our host church for the vaccination that's going to take place, mobile vaccination clinic. You'll receive more information about this at the end of tonight's presentation on May 15th, Saturday, May 15th from 9 to 3 p.m. At Mount Calvary Missionary Baptist Church, Pastor Atkinson. We thank God for his presence and his partnership. Let's just have a brief word from Councilwoman Leslie from Jurupa Valley City Council.
Thank you. Thank you all for coming and participating. I'm just really grateful that you guys were able to come together to come and help our community out right now. We are in some need of some education, some information, and some people willing to come out and give us a hand. So I'm really grateful that you guys are all able to come together right now. Thank you so much.
We certainly thank you so much for your support and your engagement in this process. This has been made possible not only by the initiation of the council lady, but also has been made possible because of the state of California. These vaccines, Moderna vaccines that will be presented on this weekend for vaccination purposes at the mobile pop-up clinic have been supplied to us by the state of California through the office of Governor Gavin Newsom. I don't see Molly Wiltshire from his office on today, but certainly want to recognize her hard work that she has been putting in. Bishop, just before we have you introduce our special guest tonight from Loma Linda University, Pastor Terry Starks, would you like to share any brief words on behalf of the faith community in Jurupa Valley?
Thank you. I wasn't ready for that. But we are excited to have this happen. I'm with you, Pastor Sam, in thanking our council lady for her diligence. She began by trying to reach this process through the county, and it kind of slowed down. She didn't give up. She sent me an email and mentioned COPE, and I told her COPE was the place, that they were already doing a lot for this engagement in the San Bernardino County. And the next thing I knew, we were having a meeting, and bless the Lord, here we are with a date, a time, and vaccinations ready for the community. And we bless God for that. We thank you.
Awesome. Thank you so much, Pastor Terry Starks, for your staying on the wall in that area. I see Pastor Michael Harvey and many of our brothers and sisters from the faith community in the Jurupa Valley area. With that being said, Bishop Kelvin Simmons, would you introduce our guest presenters tonight? And we'll be in their hands for the duration of the meeting.
Thank you, sir. We have COPE and IECAAC have had the honor and the privilege of serving with our friends and colleagues from Loma Linda University. And so tonight, that's who you will hear from. First, we'll hear from Dr. Bridget Petit, clinical psychologist at Loma Linda University. And then after that, you will meet and hear from Dr. Jam. And I'm gonna let her say the whole name because she says it a whole lot better than I do. Dr. Jam, you all prepare to take notes because Councilwoman, I wanna let you know, this is going to be worth your time, and it's going to be worth everyone's time as we listen to these powerful, powerful sisters. So first, Dr. Bridget Petit.
Good evening, everyone. I'm so excited to be here. As Bishop Simmons said, I'm Dr. Bridget Petit, Associate Professor of Psychology at Loma Linda University. I am an Ohio native and been out here in California doing this work in the Inland Empire for the past 2 years and loving the connections I'm making. Who knew that we would get to this place of doing this work with COVID, but I'm so excited to be able to apply my knowledge to help you all understand sort of the psychology of fear as it relates to the COVID-19 vaccine. With that, one of the things that we like to do is to collect information to see whether the information that we're presenting today is actually helpful, if you learned something, and if it changed your mind about the vaccine. So my student, research assistant, doctoral student Paige Brown has posted in the survey. The survey is quick. It's about 4 brief questions, and we're just asking about your attitudes as it relates to the COVID survey. It'll take about 4 minutes. Won't take too much time. And then again, at the end, we'll ask you very similar questions, just some of your demographic information, completely anonymous. We're not asking for your name or anything like that. And we're just collecting to see what is happening with the attitudes as it relates to the work that we're doing. So far, we found that it's been very effective. And so we hope tonight that you will continue in the same vein and have your minds change or get your questions answered about the COVID vaccine. So can everyone see my screen? Yes, okay, wonderful. So if you came in tonight thinking you knew everything there is to know about the vaccine, first thing I want to say is probably not. So in this blue circle is all of the information there is on the topic. And then in the red is the information that you use to make a decision. Things that influence how we make decisions are how recently we've heard information, how frequently we hear things, if things seem extreme, like I don't know if you all, but we've been just saturated with all this COVID information over and over again in the news and social media and so forth. Sometimes the things that are negative stick with us, but today what I want you to do is just kind of open your mind. And why is it important? Usually we have some information about the effects of COVID and the disproportionate rate that it's having on minoritized communities, especially Black and Latinx populations. But we know right now, this is 2021 data from February, I believe, that talks about how COVID is the #1 cause of death in this country. And so putting this all in context, that we're talking about something that's very serious, that is a threat to your health and well-being, and something that you really should take this information to heart today. Moreover, African American and Latinx populations are more likely to have COVID infections, COVID hospitalization, and deaths related to COVID in comparison to whites in this country. And so it's really important that we understand what is happening in our community and the significance of getting vaccinated, how much prevention that we can get in saving lives. It's so critical. And so I hope that you'll kind of consider the words that I'm sharing with you in light of that data. Now, I'm a professor, but I'm not going to bore you with all of these slides and data, so I promise that's sort of the last one. The rest, I just want to have a discussion. I want to talk to you about some of the things that have caused our fears in minority communities here. In the region specifically, things that I've heard at the hair shop, things I've heard, people say that they've heard at the barber shop and so forth. You may relate to some of this, and maybe you can nod so I can see you're out there listening. But the three main areas that we're hearing is that we don't really trust who was developing the vaccines. We don't trust science and healthcare. And we have some misinformation, whether it comes from our friends and family that mean well, or the media that wants to get our clicks and our likes and our reads. We get information from a lot of sources. And so I want to talk a little bit about some of those things and kind of break down some of the sources of what we call vaccine fear or vaccine hesitancy, and then what we can do. So we talk about the past government leaders and so forth. We have a new administration, so that has alleviated some fears, but we know that there was a lot of money, so more than $9 billion put towards the research and development of the COVID-19 vaccines. And so if you think about how much investment our government has made into saving lives, it just shows that this has been a priority. Now, there's so many things that we can criticize, and I'm with you in that. But I think that the investment, the financial investment that we've seen in this epidemic and pandemic is far greater than pretty much anything that we've seen in the past. And so this has just been a really important thing in our country, and it's sort of one of those things that we should be proud of, that we have kind of developed and made these strides to help save lives. One of the concerns I hear all the time is that it was developed too fast. And I actually am going to be transparent, and that was the first thing I thought. But then I actually did research, and I didn't look up the websites that are just going to confirm what I believe, but I actually looked to credible scientific websites. So the CDC, right, Centers for Disease Control, for example, or the Kaiser Foundation, not just Facebook, and went to see what my friends and family were saying. I really wanted to look and find credible sources that I know want to put out accurate data. Now that data changes from time to time. I know it's confusing, but trying to keep up is important so that you have the best information that you can have when making your decisions about the vaccine. And so today, I just want to remind you, I'm not here to tell you what to think. I just want you to sort of understand how we think, and then help you again as you're kind of weighing all the information that you're going to learn today. The speed of development, I kind of circle back to that as it was one of my initial concerns, and really understood that when you put that much money towards a scientific endeavor, you're going to have quicker results. And really what was cut was the bureaucratic red tape that kind of comes with doing research and developing new drugs. Now, I joke, and every time I say this, I always think about the people on the call who've done this with me many times. I use the same stories. But one of the things that I always think about is when I actually had to get approval to ask those 4 questions. So I know many of you already went and did that quick survey for me and saw that it was really, really brief. 4 questions, anonymous questions. It took 30 single-space pages after revisions to get it through 3 layers of review just to ask you those 3 questions. So the way that they monitor and track and scrutinize science is so intense and takes so much effort, even for something simple as an anonymous survey. So just want you to understand that the systems that are in place are really have improved and kind of had given us more accountability in terms of our research and science. So I kind of got ahead of myself on that. But I also wanted to just remind you that, you know, we know about those things that have happened in the past. And, you know, a lot of people say, oh, but Tuskegee, without even fully understanding what happened with the Tuskegee study. And you know, it was problematic, and you know, they left the 400 Black men untreated with syphilis cases for about 40 years when they knew there was a cure. Those kind of scientific missteps now, the consequences for your employment, for your license, for your ability to work, for your research funding, all those things are tied to it. And people want to keep their jobs. And so those kind of major atrocities are not common. They, you know, and we see that when things do happen, it's really rare and on a much smaller scale than what we saw with Tuskegee. But that influences us. And I know, so we have that history, we hear it from our family, and then we have our own experiences. I don't know how many of you have ever had a negative experience with the healthcare system. Anybody? Just me? Yeah, where the doctor wasn't so nice, they didn't listen to you, you didn't feel heard, and it affects what you think about their ability to provide the best care for you, whether or not they have your best interest at heart. And that is a real thing. We know that minorities tend to be treated far worse than their white counterparts in terms of the provider attitudes and so forth. But we can't let those factors prevent us from saving our own lives. We have to save ourselves. And then one of the things, and Dr. Jam may talk about this a little bit more, is that one of the things they've tried to do is to help rebuild relationships. So that's why we're doing these kind of webinars, like come and talk to people who are looking at the science and really getting factual information from people who also care about our community. And that's why Dr. Jam and I know come on and do these webinars without hesitation to make sure that, you know, our voices that we're consistent and we're connected with our community, and that you all know that we have your best interests at heart as we're discussing some of the fears. And so they've also taken steps to really increase the number of Black people in particular and Latinx people who have were in the trials to where they developed the vaccine. So they really kind of put in more effort than they normally do in that kind of research. And so that's something that is to be commended, because, you know, normally they'll just say, oh, we can't find anybody, we can't find them, we don't know where they are. And I tell them, I can help you find them. So they really did put in more efforts to find representation from all across the population, and didn't just build this on people who don't necessarily look like us. So that was a great thing. Misinformation about the ingredients. You know, there's all these conspiracies about what's in it. We don't know what's in it. Dr. Jam can answer all of that. I'm going to stay in my lane with the psychology of it, but just kind of want to tell you from a psychological perspective, and from my ability to interpret the summary of research from the Centers of Disease Control and so forth. You know, these things that we're worried about are most of the time not reality. Most of the time they're rumors, conspiracy theories, and we have to remember that. We have to really make sure that we are doing our own work, putting in the work, and not letting these small one-off cases become the thing that informs our decisions. So for example, people are worried a lot about the side effects of the vaccine. And so one of the things I looked up was, well, how often do people have allergic reactions to the vaccine? And I made this pretty little graphic for you. It looks very plain, right? That little stripe down there is the proportion of people in the entire clinical trial that had an allergic reaction. So it's very, very small. And so sometimes those visual things help us put information into perspective. So fear is normal. Fear protects us. It helps keep us safe. So I'm not here to say there's anything wrong with your fears. I had my own fears that I had to get over before I got vaccinated. When I heard how effective it was, I was like, oh, sign me up. Sign me up. Like, that's amazing. I want to get back to my family and my friends and my life. So we think we're really rational. We think like, oh, we get information, we process it, and then we make decisions. But really, our mind is very complex. And usually we're making decisions just like the tip of the iceberg. So that top 10% that you can see, where we're analyzing, thinking, and planning, right? But 90% of our actions are driven by our, what we call subconscious mind, or things that we are not even aware of. So our fears, our emotions, our past experiences, all kinds of things, our intuition, all those things really play a big role in our decisions. And in reality, when we think we make this clear decision, so information, make a decision, in reality, there are like 175 cognitive distortions, or what we call them, and the shortcuts that our brain does to speed up our decision making, right? We want fast answers. We don't want to sit and process. We don't want to think. We don't want to digest. It takes too much energy. It takes more energy to do all that. So we take these shortcuts and we're not even aware of it. So we have, again, more than 175 ways that we do that. I want you to know that we've had real threats to our community. But we've also had perceived threats where people say things that aren't true. We may have fears because things are unknown, and all of that makes complete sense. But I just encourage you to really think about how you make decisions. And we know our body responds to stress. We have several responses. So I'm going to talk about those. You probably heard of them in school back in the day, the fight or flight response, right? We're going to talk about fight, flight, or freeze. And then the fourth option that I've made just for you all to help you really think about how you make decisions. So flight, you may think the risk of the vaccines outweigh the risk of getting COVID. And that's just not true. You see the data on the COVID death rates. If you go back to that earlier slide I presented and look at that data to really tell you the truth about what's happening with COVID, people who get COVID. That's the thing that should be on the forefront of your mind as far as your risk. Vaccines, you may think, I'm invincible, I don't have to worry about it. That's for other people to worry about it. But also, think about if you have any underlying health conditions, right? Getting COVID is going to be really problematic for you. And so you don't want to think, that I don't need to worry about it or it's inconvenient. You want to make sure that you are taking care of your health and preventing this very dangerous and deadly virus. Those who freeze, I don't trust vaccines, I don't get the flu shot, I don't do any of these things. Why are they asking me to do this? This is a little bit of a different bag of tricks that we've seen with COVID. And so it's much more important because of the consequences to your health and well-being and the outcomes, the death rate. It's important to really think about that you really do your research and be open to getting information about the vaccines and not just have a blanket distrust for all vaccines. All right, fight. I don't know, the side-eye, what's the real deal? What are they trying to do to us? What are they putting in us? You hear that a lot. If you trust that people want our civilization to survive, you can trust that there are no ill intentions in terms of developing this vaccine. It's easy to believe those things that seem very frightening. It's easy to kind of buy into that, but I just encourage you to stay open and try to really fight to kind of resist those blanket statements. All right, so then think about, am I speaking from fear or not, right? Or did I really sit and listen to what Dr. Petit was saying on this webinar tonight? Having an open growth mindset. I'm going to learn more about it. I'm going to give it more thought. What are the odds my worst fear come true? So testing these hypotheses that you might have. What is your worst fear? And then what are the odds? If the odds look like that little pie that I showed you with the one sliver, and then don't tell me, oh no, I'm the exception. That'll be me, that one little sliver. That's not how data works, right? If the odds stay the same, despite your beliefs about your own individual increased odds. And so the best way to make effective decisions is really one, the thing I love about this is, as a faith community, we have to trust in a higher power. I love the 2 Timothy, God has not given us a spirit of fear. We have to remember that we have been given this knowledge. God has blessed our brains with science, and sometimes we need to use it. And I think Pastor Casey does an amazing job of kind of cutting through all of the philosophical and spiritual dilemmas and getting right to it and saying, use your faith. In my family, our motto is be afraid and do it anyway. Sometimes our fears, most of the time, are greater than reality. The things we think are going to happen, that's always the future. It's not right now. The things that are actually happening that stress us out. Know that you are not alone. Many of us had to go through our own process and thinking about this. So I hope you'll do the same. Talk to others, think about others in terms of your family and friends and those who you can help protect by getting vaccinated. be open to the information that you're gonna hear today. Gather more information even beyond what you hear using credible sources. Ask questions. Dr. Jam, she is so good about answering questions. Like, I just love listening to her and listening to all her insights. Weigh the evidence that you hear, so make a pros and cons list. And what do your pros and cons lists look like? And then take action. And whatever that action is, I'm here for it. I tell people, I'm not here to pressure you to do anything. I just want you to make any decision with a fully informed mind. And so I will leave you with a Mandela quote. I hope your choices reflect your hopes, not your fears. Thank you all so much for your time and for completing the survey. And I'm going to turn it over to my esteemed colleague in the College of Pharmacy, Dr. Jacinda Abdul-Mutakabir. Thank you.
Hi, everyone. I am Dr. Jam, or Dr. Jacinda Abdul-Mutakabir, or Dr. Jam, as most of you all know me. So I, like Dr. Petit, am from the Midwest. We affectionately call ourselves the Midwest Mafia. So I am also an implant here in California. I just moved here, so just shy of a year. So I moved here in July of last year. So I began at Loma Linda in August of last year. So I'm going to go ahead and we're going to get started with my aspect of the presentation, which will be about the fun stuff regarding the vaccines. So when I conclude the presentation, you all should be able to know the types of vaccines. We'll talk about the coronavirus spike protein mutations. We'll discuss information regarding the clinical study highlights for Pfizer, Moderna, as well as Johnson & Johnson. We'll also briefly go over Johnson & Johnson pause, and then we'll stop for questions. I do have a few slides following that. However, if you all have, we'll likely hit the pregnancy aspect when we get to the question session, but I want to make sure we have enough time for questions. So I always like to start with talking about just vaccines. So you can have live vaccines or you can have inactivated vaccines. So we'll get into just some vaccine basics. So with live vaccines, I like to use the MMR vaccine as an example. So oftentimes when you have your baby, they'll ask you to come back in 2 months where you'll get this MMR vaccine. So what this is a very small piece of an alive part of the virus. So it's as it sounds, but it's very small so that it's not able to cause true or a major infection response in you. However, if you were to ever see measles, mumps, or rubella, in real life, you'd be protected because you've seen that small piece as a baby and you've been able to make immunity or protection against it. And then we have inactivated vaccines, and they sound exactly the way that it's written. So this means that they're inactivated, meaning that they've been killed or they've gone through fire, they've gone through chemicals, they've been degraded. So that means that while they've gone through these chemicals, while they've gone through this fire, they still maintain just a small piece of integrity, so that when your body sees this inactivated virus or bacteria, is still able to make protection against it. So I like to use the Tdap vaccine as a way to really close this gap. So with this Tdap vaccine, you know that you'll have to get it more than once. We call it a booster shot. So you get it once, and then 10 years later, they tell you have to get a Tdap vaccine. Or if you have a baby, you'll make sure that everybody gets an updated Tdap vaccine. So with this, because it's inactivated, your body won't have the same type of response or protection that you would have had you gotten a live vaccine or that small piece of that alive virus. Nevertheless, should you see Tdap or tetanus, diphtheria, or pertussis in real life, you'd be protected because you would have seen it in the form of the vaccine. And now we have the vaccines that are specific to COVID. So we have our mRNA vaccines, which are Pfizer and Moderna vaccines. So our bodies make mRNA normally, just in real life. So mRNA in our bodies tell our bodies to make specific proteins so that we can survive. So in the case of these mRNA vaccines, it says, hey, you need to make this spike protein. So this spike protein here is significant to the coronavirus. So when your body makes this spike protein, it then says to itself, hey, this spike protein is not supposed to be here. So when our body sees things that's not supposed to be there, it then makes protection or immunity or antibodies against this. So should you ever see the coronavirus in real life, you be protected because you would have seen it before in the way of this mRNA vaccine. So I always get that question of, well, does mRNA turn into DNA? So I like to think about mRNA, RNA, DNA. I compare it to a moon or a honeymoon. Fortunately, I cannot take credit for this. My husband actually gave me this analogy. So when we think about a moon or a honeymoon, we know that when someone tells us that they're going on a honeymoon, we know that they are absolutely not going to the moon. So what does this mean? When we think about mRNA, RNA, and DNA, we know that they are very much different pieces. While they may have that same NA base, so where they sound alike, they're very much different, similar to that of a moon and a honeymoon. So the mRNA is in no way integrated into your DNA, is very short lasting, meaning that once your body gets that message to make that spike protein, that mRNA then leaves. So it's there for maybe about 2 days max. And then it's just eliminated for our bodies through our waste, the way things that are normally leave our bodies. And then it's never to be seen again. And then we have our adenovirus vector vaccines, or our Johnson & Johnson or Janssen and AstraZeneca vaccines. So these use a very low grade virus to insert the information that or that spike protein, or similar to the mRNA vaccine, to insert that mRNA and then send that message to our bodies to make that spike protein. So let's break this down into layman's terms. So you're injected with this adenovirus vector vaccine. Your body thinks that it's seeing a really big virus. It's like, oh my goodness, I need to protect my human. However, what your body really is, the adenovirus vector vaccines cause a very low grade virus in humans. So it's similar to a common cold. So your body thinks that it's seeing this big virus, but what it's really seeing is just that mRNA information, or that information that tells your body to make that spike protein. So while these adenoviruses aren't good for causing true viruses in humans, they are good for actually inserting in information or inserting in that mRNA to tell our bodies or give our bodies instructions on what to do next. So your body sees this virus, it thinks it's seeing a big one, instead it's seeing this spike protein. Once it sees this spike protein significant to the coronavirus, it then makes immunity or protection against it. So should you ever see this spike protein significant to the coronavirus in real life, then you would be protected because you would have seen this vaccine against it. I also get the question of, okay, well, we have this spike protein, but we're hearing about these mutations or these changes. Does it make sense to still go ahead and get vaccinated against COVID-19? I'm here to tell you that it does. So we have these, we see the spike protein here. Like I said, whether you get the Moderna vaccine, the Pfizer vaccine, the Johnson & Johnson vaccine, the AstraZeneca vaccine for our people that are overseas where it's approved, we know that no matter what, your body is going to be seeing that spike protein. So when your body sees that spike protein, it then makes protection against it. So here we see the T cells and we see the antibodies. Our T cells are our body's first line of protection. So when your body sees that spike protein, those T cells immediately rush out and they say, you know what? This spike protein is not supposed to be here. We need to protect ourselves. And then our antibodies, or our B cells, or our memory cells, they then come out to protect us against the spike protein. But it's a bit after those T cells. So maybe about 48 hours or a little bit longer, our antibodies or our memory cells will come out and protect us against this spike protein. But what they really do is they remind our bodies that we have in fact seen this spike protein. So should we ever see it again in real life, we'll be protected because those antibodies would have remembered. So we see here these antibodies are different colors, right? So that's quite representative to what our bodies do. So while you have this spike protein, you don't just have one type of protection. Our bodies make different types of antibodies or different types of protection so that it can go and attack different parts of that spike protein so that we can be protected should any type of change or mutation occur. So we hear about these mutations and what these are. This is normal. Viruses are smart and they change different parts of themselves so that they can continue to wreak havoc in human individuals, so that it can continue to grow. Coronavirus is no different. It continues to change parts of itself so that it can continue to grow in human bodies. Nevertheless, while we do see this one area that's changed or mutated, this one antibody can't go here and attack. However, we see all of these different lines of protection binding to these different or attacking these different areas of the spike protein. So what does that let us know? That lets us know that while the coronavirus may change, it may look a little bit different, our bodies are smart. Our bodies take inventory of the fact that the coronavirus can change, that spike protein can look different. So it makes different types of protection ahead of time to make sure that we're protected against those changes that will inevitably happen. So let's put this even more into lay terms. So when you're thinking about the coronavirus, originally you may have had about 1 million cells of protection. So now with these changes or these mutations or differences in this original coronavirus, you may have about 500,000 cells of protection. Nevertheless, you still have more than that 25,000 that may be needed to protect you from COVID-19. So it's still important that we do get vaccinated. And now we're going to move into our clinical studies, because it's always important to make sure that we know that minoritized individuals or individuals that's been disproportionately and majorly infected and affected by COVID-19, that they were actually protected against, or they were accounted for in these clinical studies. As Dr. Petit talked about, we want to make sure that we are holding these drug companies accountable, or these study investigators accountable when they're completing these studies. So when we look at these clinical trials, they are what we call randomized controlled clinical trials. So this means that individuals were randomly selected to be placed in a group that received the vaccine versus a placebo group, or a group that received absolutely nothing, because they wanted to know, does receiving this vaccine work better than receiving absolutely nothing? So there were about 40,000 individuals in each group, but we'll start with Pfizer. So about 9.3% of the participants in the Pfizer study were Black, about 28% were Hispanic, about 0.5% were Native American, and a little less than half were greater than or equal to 55 years old, or I don't like to say our older individuals, but our more seasoned folk. And while this 9.3% or this 0.5% may seem small numerically, it's actually quite representative to what we see in the United States demographics. So Black individuals represent about 13% of the United States demographics, and Native Americans represent about 1.6%. Hispanic individuals represent roughly around 28% actually. So it's a pretty good representation of what we would see in the United States. But when we look at the number of COVID-19 cases in these studies, we see after the first dose, however, I do want to make sure that I drive home that point. In these studies, before they actually do the clinical studies, they do studies in animals, and what they'll want to see is how much of our vaccine will an individual need before they can get maximum protection against COVID-19. With Pfizer and Moderna, they realized that an individual would need 2 shots or a booster vaccine to receive the maximum amount of protection against COVID-19. With Johnson & Johnson, you only need 1 shot, although we'll get to that information. I do want to make sure I give that caveat or explanation when we talk about the first and second dose. So with that being said, with these mRNA vaccines, they tested these prior to going into humans, and they realized that you would need 2 doses of the vaccine. So that's what these studies were designed to look at with Pfizer and Moderna, to look at how would people respond, or how would people be protected after receiving those 2 doses. Nevertheless, they give us this information following the first dose. So you're about 52% protected. So 39 individuals developed COVID-19 in that vaccination group versus 82 that developed COVID-19 in the group that did not get vaccinated. However, when we move into that second dose, which is what these studies were designed to look at, we see 8 individuals that developed COVID-19 versus 162 that developed COVID-19 after receiving the vaccination. So we only see 8 cases in that in that vaccination group, excuse me, and then we see 162 cases in that group that did not receive that vaccine. So that's where we get that 95% efficacy or that 95% effectiveness. But to make this even more relative, or to put this even more into perspective, you are 20 times more likely to be protected against COVID-19 should you get vaccinated versus not getting vaccinated. That's what they found in this Pfizer study. So that is just how amazing getting vaccinated actually is when compared to those that are not vaccinated. So when we look at the number of severe COVID-19 cases, and we know that while 95% is a high number, it's still not 100% effective. So that means we want to know, am I going to end up on that ventilator? Am I going to end up in the hospital? And there were 10 cases of severe COVID-19 total, and only 1 case in that group that received the vaccine. Amazing. So when we think about the most frequently reported adverse events, you can have a headache, injection site tenderness, you can have a low-grade fever. But I always like to say, with that fever or with building immunity or protection, you don't get to do that without some collateral damage. So collateral effects, I don't want to use damage for that, without any collateral effects. So that means that our bodies make protection at higher temperatures. So you may notice that your body temperature is a bit elevated. When your body temperature is a bit elevated, you might have a headache, you might have fatigue, you might have muscle weakness, but that's not bad. That just means that your body is doing what it needs to do to protect you against COVID-19, or to make that protection against that the spike protein is seen in the vaccine. So you'll be protected should you see COVID-19. And then of course, you're getting an injection in your arm, so you may have some injection site tenderness. With this Moderna study, it's quite similar to the Pfizer study. So a little under the 37,000 participants they had here. So we're about at 30,000, equally split in the group that received the vaccine, that did not, randomly so. And we do that just to make sure that we are ethically sound, meaning that those individuals, that we can get an accurate picture of who would do well should they get vaccinated, who would do well if they were not. And then we have about 10.2% of the individuals that participated in the study that were Black, about 20.5% Hispanic, 0.8% Native American. So very much similar to what we saw in the Pfizer study, and quite representative, once again, of the United States demographics. So after this first dose, and we talked about how that second dose is really where these studies were designed to look at. But after receiving that first dose, we see 9 cases of COVID-19 in that vaccine group versus 67 in the group that did not receive the vaccine. So now we're already seeing getting vaccinated is proven to be better than not getting vaccinated. And then after that second dose, we see 11 cases in the group that did not receive that vaccine versus 185 in that group. 11 cases, excuse me, in that group that did receive that vaccine, and 185 in the group that did not receive that vaccine. So now we're at 94.1% efficacy, or 94.1% effectiveness. So we see that we're just slightly under what the Pfizer study saw with 95%, but it's just really a difference in 3 individuals, because they saw 8 individuals with COVID-19 in that Pfizer study versus 11 in the Moderna study. So very, very small difference there. But still about 20 times more likely to be protected should you get vaccinated. So once again, this 94, similar to the 95, while it's great, it's superb, it's still not 100. So you want to see how many cases of severe COVID-19 were we seeing. So there were 30 cases total of severe COVID-19 in the entire study. There were 0 in that vaccination group. Once again, amazing when we think about getting vaccinated, the power that getting vaccinated can have. So when we think about our most frequently reported adverse effects, once again, as I told you all, our bodies make protection at that higher temperature. So you may notice a bit of a low-grade fever. When your body is at a higher temperature, you will notice that you have fatigue, muscle weakness, all that jazz. So you may not feel the best for about 24 to 48 hours. And then you can also have that injection site tenderness. Now we move on to Johnson & Johnson. So it's very similar in terms of participants. We won't waste our time there. But I will say that Johnson & Johnson had the most Black participants in their study. which they worked really hard on making sure that Black or African American individuals were included in their clinical trial to assure that their vaccine would indeed work against this disproportionately affected group, or a group that was affected a lot by COVID-19, despite the small number that Black or African American individuals actually represent in United States demographics. And then we still have about a bit over half that were greater than or equal to 60 years old, which once again is very important because these are individuals that were really affected by COVID-19. So we want to know, does the vaccine work in this group? So when we look at the number of COVID-19 cases, we see 116 cases in that vaccine group versus 348 in that group that did not receive the vaccine. So that puts us at about 67% efficacy. But I always make sure to point out the fact that in this study, we did have the most amount of variant strains included. So when we look at the Pfizer and Moderna studies, those studies didn't really include variant strains. They were done earlier on, prior to those variant strains being observed or noticed. But now we know that in this Johnson & Johnson study, the bulk of the strains or the bulk of the coronavirus that was tested there was actually coronavirus strains that had been mutated or were variants of that original coronavirus. So I like to put this into sports perspectives. I'm a sneaker fan and I'm also from the Midwest. So I'll put this into Chicago Bulls terms. So when we think about the vaccines, when we think about the mRNA vaccines, we can kind of think about those as being Michael Jordan in like 1988, 1990 Bulls. But then when we think about the Johnson & Johnson vaccine, we think about that as Michael Jordan playing against, maybe Kobe Bryant. So it's a different Michael Jordan that we're seeing there, and he has different factors. So when we think about the COVID-19, the vaccine study with the mRNA vaccines, that's kind of when we're seeing COVID-19 really prior to those changes or those differences. But we know that we see great efficacy with this Johnson & Johnson vaccine against those variant strains, which are actually what we're seeing more of when we see as we're seeing more and more patients develop COVID-19. But once again, the 67%, when we think about the 94 and 95%, is still not 100%. So we want to know those individuals that are developing severe COVID-19. So this vaccine is about 85% effective in preventing severe COVID-19. And when we think about hospitalizations or death, it is 100% effective in preventing hospitalizations due to COVID-19 and death. So I always want to make sure I hone in on that point, regardless of whether the vaccine has 95%, 94% efficacy. It still doesn't take away the fact that you could end up with COVID-19 after being vaccinated. And if you can develop COVID-19, you want to know, if I'm developing it, will I end up with severe COVID? Will I end up in the hospital? Will I end up on my ventilator? And the answer here, although we saw that difference in efficacy, is still a resounding no in terms of ending up in the hospital or ending up on that vent. So most frequently reported adverse effects, headache, injection site tenderness, low-grade fever. However, I would be remiss if we did not talk about the Johnson & Johnson vaccine pause. It's easy when we're given this information to hone in on the positives of these vaccines. And it's not to say that the pause is a negative, but it's something that we do want to make sure we talk about as well. So on April 13th, 2021, the CDC and FDA recommended that there be a pause in Johnson & Johnson vaccines. So this is because 6 women in the United States, ages 18 to 48, actually suffered from blood clotting that they found when they did their evaluation of the vaccines, or to actually determine the cause of the blood clotting. They found that they could not say that the vaccines were not a part of what could have caused this blood clotting. Nevertheless, I do want to hone in on the point that 6.8 million doses of the Johnson & Johnson vaccine had been given prior to us noticing these 6 cases of blood clotting. So what does that mean? You have a 0.00088% of developing blood clots after receiving the Johnson & Johnson vaccine. Nevertheless, if you develop COVID-19, the risk of getting a blood clot is 16.5%. So that means that for every 1 million cases, so when we look at the news, we know that there have been, let's say 300 million individuals worldwide that have been infected with COVID-19. So for every 1 million, there were 165,000 cases of blood clotting due to COVID-19. So that's why the CDC and FDA decided, while these 6 cases may have resulted in blood clot, and this could potentially be due to this vaccine, we know that more individuals actually develop blood clots if they develop COVID-19. So what we say in the scientific community is the benefit far outweighs the risk of developing blood clots when we compare blood clots due to COVID-19 versus blood clots due to receiving a Johnson & Johnson vaccine. Nevertheless, these blood clotting events did develop about 16 to 13 days following vaccination. So if you receive the Johnson & Johnson vaccine, you want to make sure that if you're about 16 to 13 days out, if you notice any headache, any blurred vision, any fainting or loss of consciousness, any severe stomach ache, back pain, seizures, you want to make sure that you do seek medical attention if these things cannot be explained by anything else. So say that you have a headache or blurred vision, however, you know that you're diabetic and you have not taken your insulin. We know that hypoglycemia can also present with some of these symptoms. So if you have these symptoms and you cannot attribute them, or you can't say something else may have caused them, then you want to make sure that you seek medical attention if you receive the Johnson & Johnson vaccine. When I say that you'll have a headache or you'll have stomach pain or back pain, it will be the absolute worst pain that you have ever experienced in your life. You will know that something is absolutely, undisputably wrong. So the actual chance of developing this is very, very, very low. And I also want to say that while this may raise everyone's antennas and say, wait a minute, let's, also look at the other side of this and be thankful that the CDC and FDA made sure that they wrote the tape back, and they actually looked at these vaccines to ensure that they are indeedly safe, to ensure that they are indeedly effective, and they stopped the party for 6 individuals to make sure that these vaccines weren't being given out and they could potentially cause very, very bad things in mass amounts of individuals. So they didn't find that they could cause bad things in mass amounts of individuals, which is why we are currently still injecting individuals with the Johnson & Johnson vaccine. So the pause lasted about 10 days, but I did want to make sure that we talked about it. So nevertheless, with these COVID-19 vaccines, they put us one step closer to herd immunity. So what I mean by that is when it's herd immunity, that means that a good amount of the population, and Dr. Fauci says we need about 70% of the individuals in the United States to be vaccinated against COVID-19 or to have immunity against it to be protected or for it to slow that spread of the virus. So by no herd immunity, we see that it's very easy for that virus to go from person to person. However, when we do see herd immunity, or we see that individuals are immune or colored in that green, it's harder for that virus to go from person to person. When we say immunity, you can either develop immunity through receiving a vaccine or by having COVID-19 naturally. We really don't want people to develop COVID-19 naturally, right? Because we don't know how people will respond. We just talked about the blood clots. It's very dangerous to play that game of COVID developing or receiving or having COVID-19. And we don't know for sure if individuals will come out on the other side of it. So we want people to become immune by actually receiving that vaccination. So either 3 of those vaccines will give you that immunity or that protection against COVID-19, and then it'll be harder for that virus to then go from person to person, and we can start really resuming life the way that we remember it. So I want to end with saying, let's really take a look at the COVID-19 vaccine so we can see in this placebo group, or in that group that received absolutely nothing in terms of the vaccine, we see just a steady increase of COVID-19. But when we look at that group that received the vaccine, we see that there are not very many cases. Of course, this will look a little bit different if we factored in Johnson & Johnson. This was made after the mRNA vaccines, but nevertheless, still significantly lower than what we see of that group that did not receive that vaccine. So this is how important being vaccinated against COVID-19 is. So I see we have some questions. I can go ahead and prepare to answer those.
And so, Dr. Jim, we do have one question. Do you know the origin of COVID-19?
So I think that the origin is honestly something that none of us know for sure, but they say that it was due to some type of animal contraction. So that being maybe a bad. So animals normally have coronaviruses. And the issue is that we as humans don't have the same coronaviruses as other mammals or other animals. So should we somehow be infected or inoculated or some way capture whatever coronavirus that they have, it could present as really bad and be very fatal in us as humans, which we're seeing currently with COVID-19. So that is potentially the way that COVID-19 was disseminated. So of course there was a patient zero in Wuhan, and then it's very easy, as I showed you all with that picture, for that virus to then go from person to person to person when you don't have any vaccine, or it goes unchecked as far as social distancing and stopping the spread. So the minute that we had the minute that the person in Wuhan got infected, we were pretty much in bad shape. But the minute that that plane came back from Wuhan, that likely put us in a different situation, because now the virus is then traveling from its origin to a different place, which is why we always say when you have to be careful with traveling in regard to these variant strains. So that's when we think about how did the UK strain end up here in the United States, or how did the South African strain end up here in the United States? Because you move from one place to another, and then you end up in another area and you bring things with you, that being the coronavirus.
Another question, isn't there therapeutics for COVID besides the vaccine? Do you prescribe these like ivermectin or hydroxychloroquine?
So I will be very transparent in saying that, they have been working to evaluate different treatments against COVID-19. However, none have proven to be significantly effective against COVID. So our best bet at getting over COVID-19 is ensuring that we're able to get out ahead of it. How do you do this? By getting vaccinated. So the antibodies, they may work, they may not work. The convalescent plasma, it may work, it may not work. The ivermectin, they have not seen promising results at all. With the hydroxychloroquine, it's actually recommended that we do not use hydroxychloroquine because it can cause a slowing of the heart, which can then be a really big problem when compared to COVID. Or honestly, when you think about COVID-19 and giving hydroxychloroquine, if you're already in this state where your body is compromised, you don't want to give hydroxychloroquine, which can stretch out your heartbeat in combination with your body already being in a bad state due to COVID-19. So the medication therapies are not very promising against COVID. So that's why it's important that we do get vaccinated.
Thank you for that. And Mr. Liu has a question.
Hi, so great to have you back again, Dr. Jim. And for update, the FDA just approved the EOA for the adolescent age between 15 and 12 a couple hours ago. And my question is, in case we need to call to our schedule appointment for the vaccination for the kids, do we need to ask specifically if they have the vaccine specific design for kids age between 15 and 12? Or
Yes.
is there a difference in the dosage compared to those administered for the adults?
Right. So, yeah, I think that Ms. Contreras just posted that. So, yes, Pfizer is approved for 12 and up. There's no difference in the amount of the vaccine that they receive. So they receive the 0.3 mLs that an adult would receive as far as the vaccine. So when you call, you can say I have a 12-year-old or someone under the age of 18, because for all the rest of the vaccines, you have to be 18 and up. Pfizer is the only vaccine that you can give for under the age of 18.
Okay. And my second question is, and I think Dr. Fauci has been talking about possible the likelihood of a third booster in case of this and the variants. And I mean, is the same kind of the booster, the second shot and the third shot, are we taking the same kind of booster shot or a different kind of booster shot?
In terms of if you have to receive the
Variant, yeah,
vaccine
the third one.
again. So let's think about this as a yearly vaccine. So when you receive the vaccine, it'll be you receiving. So yes, we can say that it's a booster, but it'll be you receiving another series of the COVID-19 vaccine. You with the amount of variants or the amount of changes that are undergone that are occurring with the vaccine every day, we hear about a new variant strain, or how easily meaning how easy that these other variants or mutations can go from person to person. That lets us know we're likely going to have to get vaccinated again because those other vaccines did not account, for the changes or for the mutations that occurred. So Moderna, like I told you all, Moderna and Pfizer came out a bit after the fact. So the benefit of these mRNA vaccines is it's very easy to change them to put those mutations into that mRNA information that they have. They've already begun doing research and working on that. They've already received the variants. Dr. Kismeki Corbett, she often discusses, and her group actually published a manuscript on the new variants and how they receive them and how they've been working to make sure that that the vaccines that they're creating work adequately against them. So currently the vaccines do work against the mutations. However, we don't know if that'll continue to be the case. So it's kind of a matter of let's get ahead of this before it becomes an issue, before we find ourselves in the same exact place we were in December, this next December. So let's think of this as a yearly vaccine. So it'll be, I guess you can call it a booster, but it'll really be just you receiving that vaccine again. So just reminding your body that you have in fact seen, COVID-19, or when you think about the flu virus, you get vaccinated every year, right? And when you get that other vaccine, you say they account for different strains of the flu, or for different types of flu that may be out that season that will go ahead and wreak havoc. So let's think about this COVID-19 vaccine like that. So then it'll account for different strains or different changes in COVID-19. So it'll account for that South African variant, that UK variant that may be present and very prevalent at that point in time, wreaking havoc.
Thank you. Thank you so much, Dr. James.
Mm-hmm.
Okay, thank you, Dr. Jammer. We do have a couple of more questions that have been raised. One of them is concerning the Johnson & Johnson vaccination and women. Could birth control be a factor regarding the side effects?
So, of course, birth control can cause blood clotting as well. They did not determine that there was some type of causality between the women that developed COVID-19, that developed the blood clots and birth control. So it wasn't that every woman was on birth control and then every woman developed the blood clots. So there's no way to actually know whether the birth control will have some type of effect on whether you develop the blood clots. I will say that our bodies clot normally in response to vaccines, or it's an immune response. So the blood clotting is protective against any type of foreign invader that we may have. Our bodies clot in response to that to protect us. So with the Johnson & Johnson vaccine, it's a bit of too much blood clotting. So they think that it may be some type of immune response that is that we can kind of attribute to the way that the vaccines are made, the fact that they are adenovirus. So the fact that they use a virus to actually send that information or that mRNA info to make that spike protein. So they think that may be the reason that individuals have that huge immune response that may have resulted in that blood clotting in the 6 individuals, not necessarily the fact that they were on birth control, not that each of them were on birth control. So I say all of that to say that birth control has not been shown to be a major factor in causing the blood clotting. And I do want to go on record saying that blood clotting is significantly rare, very, very, very rare. So I would not say to, stop taking the birth control if you are getting the Johnson & Johnson vaccine. You'll be perfectly fine doing both. However, if it's about 16 to 13 days following receiving that vaccine and you feel the symptoms that I talked about, so that really bad headache, that really bad stomach ache, that really bad leg pain, then you want to make sure that you do go ahead and seek medical advisement, medical attention.
And also regarding antibodies in patients who may have had COVID, do they have enough antibodies that would basically mean that they would not have to get the vaccination?
So the biggest thing with this is that we don't know how much protection an individual develops after they have COVID-19. So we don't know that if you have COVID-19 and you are asymptomatically infected, meaning that you have no symptoms, we don't know that you develop the same amount of antibodies or the same amount of protection as someone that may have had severe COVID-19, meaning they ended up in the hospital on that ventilator. But what we do know is the amount of protection that you develop after having received these vaccines. So that's why we say it's important that you get vaccinated, because we know for sure that you're protected against COVID-19, and we know at least that you're protected for 6 to 9 months. We'll get, of course, more information as these studies were designed to continue for 2 years. So we'll get more information, likely quarterly, on how long we can expect to be protected against COVID-19 with these vaccines. However, we don't know the protection that you have based upon the different COVID, I guess, risk or COVID infections that you can fall into. So whether you have asymptomatic, mild, moderate, severe, we don't know the amount of protection that you develop there. And I will say that I do have patients that have had COVID-19, and then they end up back in the hospital with COVID-19 again about 3 months later. So that has been a very big, that's been a very big and a very much common occurrence across the scientific community, is seeing those individuals be readmitted in about a 3-month time frame with COVID-19. So that's why it's important and that's why we do also tell individuals that if you, so say that you test positive for COVID-19. So if you are outside of that 10-day window, meaning that you've passed that 10-day quarantine period, we advocate for you to get vaccinated against COVID-19 if you are not exhibiting any symptoms of COVID.
And someone did raise the question of the 3 vaccinations, which one would you say is better?
The one that's in your arm. That's what I always say. But I myself received the Pfizer vaccine, so I always offer that info. My husband received the Moderna vaccine. My family is pretty much split on those that receive Pfizer and Moderna. I have been, I participated as the lead pharmacist and clinician in our mobile vaccination clinics with Loma, and I have successfully vaccinated over 1,300 individuals with each of the vaccines. So as I stated, our big push is for herd immunity. And I talked about you can develop herd immunity by naturally becoming infected with COVID-19, which can be an issue. And because we don't know how people will respond to COVID-19 being naturally infected, or you can develop immunity by receiving a vaccine, seeing that small piece of the coronavirus, and then your body making protection against it, or antibodies or immunity against it, right? So either one of those vaccines will get us to that place where we're able to have herd immunity and get even closer to resuming life as we normally know it. So that's what I state is your own personal choice. And right now, I guess we have a lot of, we have the luxury of options. So when you go to these different vaccination sites, some of them have days where they're doing Moderna, some have days where they're doing Pfizer, some have times where they're doing Johnson & Johnson. We now have access in CVS and Walgreens, different pharmacies where you can receive the vaccine. So it's really up to you, but I stand by all 3 of them.
Awesome. Are there any other questions for Dr. Jan? Yes, Ms. Frazier, you can come off mute.
Thank you so very much. And I definitely appreciate the lesson. It really has enlightened me. A question I had about the studies that were done. Johnson & Johnson, you mentioned that they included other strands when they did their studies. So my question was, with the other two studies, did they include strands that they were familiar with at that particular time? Or is it that they just only dealt with the virus and the strand that was available during the development time of the vaccine?
Right. So when we think about this, we have to think about just the timing and just what was here, what was prevalent in the United States. So the variant strains weren't discovered. So they concluded the Johnson & Johnson, excuse me, the Pfizer and Moderna trials. They concluded them in November of 2020. So we didn't even discover the South African and UK variants until December. In January of December of 2020, January of 2021. So the Johnson & Johnson study, however, was not concluded until late January of 2021. So they had that opportunity of being of just, or is it an opportunity or the unfortunate consequence of just having more individuals that were infected with these variant strains, because that's what was prevalent during that time. And they also had a good amount of African includees, a good amount of includees or participants that were from the UK. So those were the strains that were prevalent where they were conducting these studies. They had a great amount of United States participants, but then once again, at the point in which that study was concluded, meaning that they stopped the study, those strains were rapidly across the pond, and that's what was being observed in the patients. So with Moderna and Pfizer, when they stopped the study, those were not identified yet. So all they had is what the patients had. So with that being said, all they would have is just that original strain of COVID-19, because that's all the patients had. But once December hit, and we got word of just this more powerful strain, it was pretty much kind of like everyone had it after December. I think we first heard about it as far as like I have a group of girlfriends that are ID pharmacists as well, and we sent the picture in the group like, oh my goodness, it's a variant strain. We heard about it, I think, in the beginning of December, and then as quickly as we heard about it was as quickly as we found the strain here in California, and then it was as quickly as that's all we see now is the UK and South African variants. So it's a matter of what was there. However, when we look at just how these vaccines are performing now, when we talk about, there's an 80% and 90% chance that you won't transmit the virus to other individuals if you are vaccinated. We know that from the information that we have currently from the vaccines. So that means that people that are being vaccinated with Moderna and Pfizer, they have that opportunity to be infected with these bad strains, and we're seeing that they're not. So in this tail end of study evaluation, or in this tail end of actually seeing individuals get vaccinated, we're seeing just a reduction.
Are there any other questions for Dr. Jam?
I do have one more question that was raised. What is your take on fertility in the vaccination?
So actually, we just had evidence or literature released from the CDC in terms of pregnant women that were vaccinated. And I believe there were about 4 million pregnant women that were vaccinated, and they did not observe any significant risk. No significant risk worth reporting, or from what they reported to us. What I will say is that the World Health Organization, the Centers for Disease Control, the American College of Obstetrics and Gynecology, and I don't know if I said the FDA yet, but they all are on board for pregnant women being vaccinated, because that, like I talked about with the Johnson & Johnson vaccine, that benefit far outweighs the risk. So that benefit of being protected against COVID-19 when you're pregnant, that for those women that have been pregnant, being pregnant can already cause some stress and strain on your breathing and etc. So getting COVID-19 could really be detrimental, not only to the mother, but also to the baby. But I will say that in the Moderna trial, they actually had 13 women total that were pregnant that did not know that they were pregnant when they were included in the study. And 6 women were in the group that received the vaccine. 7 women did not receive that vaccine. And they only noticed poor pregnancy outcomes in the 7 women that did not receive that vaccine. And then the Moderna study conductors also tested their vaccine in pregnant rats. And it's important that we know this because pregnant rats do share a similar biology to humans, and they did not notice any type of poor pregnancy outcomes there. So we have that. And then when we think about the mRNA, as I told you all, is not in any way turned into our DNA. So let's think about our moon and honeymoon example. And then it's very short lasting, meaning that it lasts in your body for about 24 to 48 hours. Once your body has that message to make that spike protein, that mRNA is eliminated. So in no way will it have time or just any type of integrity to influence fertility. So I think that you all should be very much, I hope that your fears are assuaged in terms of fertility and the COVID-19 vaccines.
Okay, and I have one final question. Should we start preparing everyone for a yearly vaccination?
That's something that I do. So I'm very transparent. And I think that it's important that we do prepare for a yearly vaccine for COVID-19, at least for the unforeseeable future. And in the event that, we get information that comes out and they say, hey, you don't actually need a yearly vaccine, then, clap, clap, hooray. It's exciting that we may not need a yearly vaccine, but I think that we should prepare for a yearly vaccine.
Awesome. Thank you so much, Dr. Jam. As always, you are our rock star. We thank you so much for always availing yourself. Let's give it up for Dr. Jam and Dr. Petit for their participation. We pray God's blessings continuously upon you and Dr. Petit for your labor and for your participation in this process. Once again, I just want to recognize our new champion, new Shiro, Council Lady or Councilwoman Leslie Altamirano. Is there any closing remarks you would like to have, Council Lady?
I'm just really thankful you guys were able to come out. Thank you so much. The information was great. You guys were able to answer a lot of the questions here. I mean, we have about 25, 26 people here. I'm just really grateful you guys were able to come out and make it. And I'll see you guys on Saturday.
Indeed. While saying that, listen, we just want to remind everyone that 500 shots, we still have tons of room left, tons of appointments available at Mount Calvary Missionary Baptist Church from 9 a.m. to 3 p.m., a partnership of SAC Health, City of Jurupa Valley, Mount Calvary Missionary Baptist Church, Rubidoux Missionary Baptist Church, COPE, Inland Empire Concerned African American Churches, TODEC, and IEHP. We want to make sure that you do show up on Saturday. Listen, we have still literally close to 300 appointments available. So listen, let's make sure we fulfill all 500 of these slots. We need to make sure that we fulfill all 500 of these slots. If you have not received an email or information update, please drop your email address in the chat feature so that we can send the updated information to you. I'll drop again in the chat feature the way for you to register for your appointment. We are receiving and accepting walk-up appointments. No one will be turned away. They must be 18 years of age and older. The vaccine that will be used on that day is the Moderna vaccine. So make sure that you get this information to those who would like to be vaccinated, family and friends. And listen, they don't only have to be from Riverside County. If you have, the focus is Jurupa Valley because this Shiro of ours, Council Lady Altamirano, reached out to us. But if you have family members who live in surrounding communities, make sure that you grab everybody and lottie-dottie to come and be vaccinated on May 15th at Mount Calvary Missionary Baptist Church in the city of Jurupa Valley. With that being said, make sure you take the post survey. We want to make sure that we're keeping accurate information so that we can always improve on this presentation. There's a link page. Is there any information you want them to have, Paige, just before we close out?
No, no other information. As Dr. Petit said earlier, it's totally anonymous. We're not asking for your name or anything like that, just maybe some demographic features. And there's only about 4 questions. So it should be very quick.
Thank you so much. Listen, let's make sure we get all of these slots filled. And once again, this has been brought to you by Councilwoman Leslie Altamirano, Sachs Health, City of Jurupa Valley, Rubidoux Missionary Baptist Church, Mount Calvary Missionary Baptist Church, congregations organized for prophetic engagement, the Inland Empire Concerned African American Churches, and Loma University. At this time, we're going to call our new brother to come and close us out with a word of prayer. Padre Guillermo Martinez from St. John Catholic Church in the city of Jurupa Valley. Thank you so much, Padre, for being with us today. Close us out with a word of prayer.
Okay. In the name of the Father, and of the Son, and of the Holy Spirit, thank you, Lord, for your sons and daughters that today share with us their knowledge about this pandemic. We ask for them, for all the scientists, and for all the people, all you leaders in the world, especially here in Jurupa Valley, for this service for our brothers and sisters through the vaccination. We thank you for everything, Lord, for your intervention in this pandemic, and we ask you to bless all of us. In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Amen. Thank you all so much. Thank you so much, Padre. And we will see all of you on Saturday. For those of you who are coming to the Jurupa Valley location, we will see all of you on Saturday. Be on the lookout for updated emails for how to register and how to stay connected. God bless you. Once again, we thank you all so much for joining us tonight, and may the peace of the Lord be with you.